Hey guys, hope you're doing well. I wanted to make this video to answer a few questions about what it's like to be a psychiatrist. My name is Sivapriya and I work as an assistant professor in Manipal. I've been a psychiatrist for about 4 years now. If I'm sensitive or if I'm emotional, can I take psychiatry as a career option? Honestly speaking, there is no contraindication of that sort to taking psychiatry as a career option. I consider myself a sensitive person and I do enjoy working in psychiatry. That being said, like any other job, psychiatry has certain challenges and certain challenging situations. And that's something to think about, whether these kind of situations would be something that impact you, and is that something that you want to be exposed to and deal with on a consistent basis. Naturally, as a psychiatrist, part of your job is dealing with emotionally charged situations, and the kind of people who come to you have problems of emotional nature, right? So they may have depression, anxiety, suicidal thoughts, including things like sexual abuse, childhood trauma, neglect, parental issues. So some, as you can understand, some very emotional situations. Are you okay talking about it? Are you okay helping them? Because this is part of your job, right? And it's going to happen every day in OPD. And I would say it's not the same as dealing with death due to physical illness in branches like medicine or surgery. I think this is different, and it takes a little bit more time to build that skill to separate your work from your own self, and to not let the work or the nature of the emotions that you deal with at work affect you emotionally. And this is coming from an emotional, sensitive person myself. I also think people are different, and I don't think everybody deals with this as a challenge, because people have different degrees of sensitivities to different situations. And what I've noticed for me is generally when my mental health is good, I'm able to manage it quite well. If it's a situation that comes up when I'm going through something emotionally in my life, and that's something that happened recently, I can make a video on that. For me, I've noticed it can create thoughts pertaining to like burnout. I feel like, what am I doing here? Am I really helping? Should I just leave my job? So burnout is something that can happen, and it's happened to me, I would say, once or twice over the course of years. My entire psychiatry journey has been 3 years of residency, junior residency, 3 years of senior residency, and then assistant professor. So it's happened to me twice, and I can go into details talking about it. But to quickly answer, it's not a contraindication. But these are some things you can think about, how it is to deal with emotional situations daily, because there are a lot of challenging situations that could come up as part of your career. What are your working hours like? Working hours depend on what is the nature of career you decide after your residency. Junior residency, I would say, is probably 8 a.m. to 8 p.m. Some places may call you earlier, around 7:30 and 7:30. Some days may go a little later, like OPD days where you have a lot of admissions, you need to work up more cases, it may be a little later. But generally speaking, I would say most institutes, it would be around 12 or 8 a.m. to 8 p.m. with a lunch break in middle. Then it is a challenging job, it is stressful. There are 36-hour shifts even in psychiatry. Yes, there is. It's not as often, but that being said, it's very challenging. So another question I get asked frequently is like, what's the salary like as a psychiatrist? I earn around 1.3 lakhs, and I work as an assistant professor, so I work in a teaching medical college. The nature of income differs on many things. Like, it also depends on whether you have a practice outside, or do you not have a practice? Is it a private college, a government college? Is it a central government college? So many things determine this. I really like not having a private practice, because private practice hours are quite extensive. You have to be available a lot of time, so it can even go on till 10 p.m. So the hours in private practice is a lot more, which I don't think is best suited for me. I'm happy with working in a medical college. Yeah, there are great opportunities abroad. I would say abroad in the sense UK, Australia, Middle East, these 3 countries, definitely clinical positions are possible. Whereas if you look into US, Canada, those countries, research positions are possible, but clinical positions you have to go through their system, no, their USMLE and things like that. So you'll have to repeat your residency. But in UK, Middle East and in Australia, they have different programs which allow you to migrate after your MD as well. So your years of doing MD will be counted. You'll have to do some degree of training and clear some exams, like each of these institutes have their own licensing exams. You'll have to clear that, but there are different pathways which you can take. In terms of income in this context, I would say Middle East and Australia have better income prospects. UK, the income is a little lesser, but from what I hear, the working hours are great. Of course, this is a very sensitive topic which requires a nuanced discussion. That being said, just from my experience speaking, the way that we've practiced psychiatry right now, I mean, that is during my residency and now, there's a lot of respect to the autonomy of the individual. We take a very biopsychosocial approach, which means that we're not just compelling people to take medications. We're also looking at the situation from a psychosocial perspective. So we work with psychologists, psychiatric social workers to see how we can help them beyond medications. This is something that we do routinely to work as a team in order to help holistically. So yeah, from a practice perspective, that's what I want to say. But this was an advice given to me when I took up psychiatry too, to read up on the anti-psychiatry movement. It is very different, right? I mean, a lot of this started in the 1900s. So the way that we practice now is very different from what it was like. But that's something to keep in mind, because it's going to keep coming up. You know, people are going to bring it up, and there's going to be a lot of stigma towards psychiatry, towards psychiatric patients, towards psychiatrists, and that's something that we deal with on a day-to-day basis. Yeah, but definitely read up a little bit on it and see how that makes you feel, because if it makes you feel uncomfortable, think about it. So yeah, that's it. Hope you enjoyed this video, and hope I've answered some of your questions. If you have some more questions, make sure to put them down below, and I'll try to answer them to the best of my capacity. Yeah, take care, bye-bye, all the best.